Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning for another segment. In this segment, we're going to be speaking with Professor Murali Doraiswamy. He's joining us here as a professor of Psychiatry and Behavioral Sciences at Duke University School of Medicine to discuss some recent findings from a survey that showed that about 2/3 of doctors believe that psilocybin therapy has potential therapeutic benefit, especially for patients with treatment-resistant depression. Welcome to Health Professional Radio, Professor Doraiswamy. Thank you for joining us.
It's a great pleasure.
Tell us a little bit about yourself, and then let's talk about this treatment-resistant depression.
Sure. I'm a professor of psychiatry and medicine and a member of the Duke Institute for Brain Sciences at Duke University School of Medicine. I'm a psychopharmacologist, so a lot of my work is in developing new treatments for psychiatric disorders such as depression, anxiety disorders, cognitive disorders, and I also work with patients and clients, helping them manage their conditions.
Depression is a widespread condition, is it not?
Absolutely. More than 300 or 400 million people around the world are estimated to suffer from depression. And of course, all of the issues pertaining to the pandemic have made things a lot harder on everyone, and depression rates have increased perhaps, one or twofold or two or threefold since the pandemic began.
Now, although depression rates have increased, some of the go-to treatments have not changed in many, many years. However, there is a type of depression that is resistant to the normal go-to treatments. Is that correct?
That's correct. This condition is called treatment-resistant depression. You can think of it as sort of the fickle, evil twin of your regular depression. So regular depression is treated with either medications or psychotherapy or a combination of the two. And we find that up to about 1/3 of people with depression fail to respond to at least 2 different modalities of treatment given in adequate doses for 6 to 8 weeks. Then the condition is termed as treatment-resistant depression. And treatment-resistant depression, of course, causes enormous personal and societal toll. And, because it's harder to treat, it's also more expensive. It also results in more suicides. It also results in greater work loss and disability.
Does the cause of the depression determine whether or not it's going to be a treatment-resistant type of depression?
It's a great question, right? Just like depression is very heterogeneous, treatment-resistant depression also has heterogeneous causes. So one could be treatment-resistant because of biological reasons. Maybe the chemistry and the circuitry in the brain is such that, or the genetics is such that the existing medications don't work as fast for you. It could also be because you have comorbidities. You have severe medical illnesses, you have chronic pain, you have addictions, you have post-traumatic stress disorder, and as a result, it's not just enough to treat the depression with the medications. You have to also sometimes manage those other comorbid conditions. And the third is, it could also be socioeconomic. For example, someone's going through severe job loss, a personal tragedy. All of those issues may not sometimes be fixed just by, a simple antidepressant therapy. So you're absolutely correct that we have to address these multiple factors that trigger depression.
Now, I did mention that we were going to talk about a recent survey that talked about psilocybin as a therapeutic benefit to this type of depression. Who conducted the survey and how was it conducted?
So the survey was conducted by Sermo in conjunction with Compass. Compass is a biopharmaceutical company that's developing a synthetic form of psilocybin as a novel treatment for treatment-resistant depression as well as treatment-resistant PTSD. Sermo is a social network for doctors and one of the largest, if not the largest, social network for doctors. There's something like almost 1 million doctors from over 150 countries around the world that are part of the social network. And it's not just a network for having fun. It's primarily a professional network where doctors can exchange information, get second opinions, can sort of informally run their cases or X-rays or MRI scans or diagnosis or treatment options with other doctors, get opinions. And also, it's an amazing platform for getting real-time surveys and insights from practicing doctors who are on the front line.
As far as psilocybin is concerned, is this something that is becoming more mainstream among physicians?
Psilocybin is a investigational product currently, even though it's available. Psilocybin is derived from mushrooms, but the version of psilocybin that is being developed as a pharmaceutical is a synthetic product. It's being developed by a company called Compass Therapeutics. Mm-hmm. And the form of psilocybin that they're developing as a treatment is called Psilocybin Therapy. So they're combining a specific low dose of psilocybin with a specific form of supportive psychotherapy combined with a specific program. So the whole combination program is what is being developed as a therapeutic for treatment-resistant depression and treatment-resistant PTSD. It's not just your run-of-the-mill psilocybin that you can buy sort of, in a spiritual retreat, or you can get in some sort of pharmacy or something like that.
Psychedelics have been around, forever. Why do you think that it's now becoming a little bit more mainstream as far as treating some types of depression?
So yes, you're absolutely, as you point out, they've probably been around for millennia, right, since the dawn of humanity, because people, spiritual users and those seeking sort of enlightenment have always turned to psychedelics. About 4 or 5 decades ago, there were a number of research studies done with psychedelics for treating various conditions such as psychiatric diseases, chronic pain, neurologic diseases, etc. But then the government made it illegal to research these compounds and also classified them as a controlled substance with no use whatsoever. So it became very hard to obtain these compounds to do research. Only over the last, 6 to 7 years, have we had sort of what I call a renaissance, where now large, well-controlled clinical trials have been done, which actually justifies the enthusiasm. For example, with psilocybin, about a year ago, a study was published in the most prestigious journal in the world called the New England Journal of Medicine, and the study was conducted by Compass Therapeutics, where they compared a specific dose and a specific form of psilocybin against a widely used antidepressant. And they found that psilocybin was not only as effective as the antidepressant for treating treatment-resistant depression, but on a number of secondary measures appeared to be superior. And more recently, they have completed a very large trial of over 200 subjects with treatment-resistant depression, looking at 2 different doses of psilocybin compared to a control condition. And they found, again, that 25 milligrams of psilocybin was highly effective. And the drug is very effective in a very short period of time, and also appears to induce some long-acting changes. I think so. Really, it's the combination of things: well-controlled trials, better understanding of the dosage, a better understanding of how to combine psychedelics with supportive psychotherapy. We've always known that combining medications and psychotherapy works better than either alone. So I think it's a combination of factors, and the renaissance and the enthusiasm, I think, is justified, but it's still not available for routine prescription.
So what do you think the main barrier to that availability is going to be, or currently is?
So there's a number of barriers. One is, of course, we need definitive phase 3 clinical trials, and then the evidence has to be submitted to regulatory authorities, and then the regulatory authorities have to approve the use of these drugs. And then in various countries, there are also legal barriers to using these drugs. So the Controlled Substance Act in the U.S., for example, it categorizes as Schedule 1, so that may need to be changed to allow doctors to prescribe them. And then, of course, as with any medication, we need to make sure that we keep safety in mind. So we need to make sure that the drugs are not diverted for illegal use or recreational use, and they're used appropriately in the right medical settings to ensure safety. So I think with the combination of these factors, I'm very hopeful that in the next 2 to 3 years, we will get these drugs, to help people with some of these devastating conditions.
Well, I appreciate your time this morning, Professor. If you would, give us a website where our listeners can learn more if they choose.
So there's 2 different websites. For those who want to learn about Sermo, you can just go to www.sermo.com. For those who want to learn about the development of psilocybin by Compass Therapeutics, you go to www.compasstherapeutics.com.
Well, once again, I appreciate your time, and thank you so much for joining us here on Health Professional Radio. It's been a pleasure.
Absolutely. It's a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Professor Murali Doraiswamy. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.